Hello everybody, myself Dr. Amit Kamath. I am a consultant physician cardiodiabetologist practicing at MedStar Specialty Hospital, Kodgiyalli, Bangalore. So today on the eve of World Hepatitis Day, okay, and I'm going to tell you about what is hepatitis and how can you prevent the hepatitis, its do's and don'ts. So the theme for this World Hepatitis Day is it's time for action. Okay, so hepatitis is basically inflammation of the liver. Okay, inflammation is nothing but swelling of a tissue in the body when it is injured. Okay, so now this hepatitis can range from various non-infectious as well as infectious agents. Among the infectious agents, there are various viruses, that is hepatitis A, hepatitis B, hepatitis C, D and E. So I'll tell you in detail how these viruses are going to affect the individual. Among the non-infectious agent, various over-the-counter medications and some certain chemicals and unknown Ayurvedic medications can cause hepatitis. This WHO suggests that it has been estimated almost 4.5 billion of the population, okay, among the low or middle class populations, death can be prevented by the year 2030, okay, through the vaccinations, various diagnostic tests, as well as the treatment protocols. Among the various viruses that causes mortality, 90% of the mortality is basically because of hepatitis B and hepatitis C. Now coming to various types of hepatitis. Hepatitis A, which is basically transmitted through the fecal-oral route, that is by the contaminated food as well as water. So here the patient can present with fatigue, jaundice, loss of appetite and anorexia. So hygiene measures has to be taken and food has to be cleaned properly before preparing it, and hand washing measures has to be taken, okay, before taking any sort of food and to be eaten at a hygiene place. Second, hepatitis B is basically through a sexual transmission, also through the needle injuries or through the blood transfusion. This particular hepatitis B can affect. Here also the patient will suffer with anorexia, jaundice, fatigue and loss of appetite. Okay, so it can be prevented by vaccination. Hepatitis C is again basically due to the needle injuries, okay, and also from blood donation through an infected person. So these hepatitis C symptoms are also anorexia, nausea, vomiting, jaundice, fatigue and loss of appetite. Okay, so this can also be prevented. Third, that is hepatitis D. Hepatitis D is basically seen during the pregnancy, okay, and this is also basically transmitted through the needle injuries as well as the fecal-oral route. Fine. So here also the patient will be suffering with a similar kind of symptoms like hepatitis A and hepatitis B and hepatitis C. This can also be prevented by giving hepatitis B vaccination. Hepatitis E most commonly seen in the pregnancy by the fecal-oral route, that is contaminated food and water. So this can also be treated by taking a hygiene measures. Fine. Now coming to the do's and don'ts, what you can do and what you should not do when a patient is suffering from hepatitis. So you can do is basically take ample of rest, drink at least 6 to 8 glass of water, okay, avoid junk foods, okay, and you have to take hygiene measures, you have to use safety sexual protocols, fine, and you should consume more green leafy vegetables and fruits. What are don'ts? So avoid taking tobacco and over-the-counter drugs, avoid consuming alcohol, avoid acetaminophen, and avoid using the sharing of razors, trimmers, or any sort of things which are being used by the basically the infected person. So if you follow these measures, you can definitely overcome hepatitis, and we together can fight against the hepatitis, and we can we can have a very good quality of life. Thank you over and all.